Today I'm delighted to be joined by Dr. Laura Kokinda, psychologist, and Joanne O'Brien, Medical Services Administration from LA Emergency Management. You guys have just been such a solid source for great information for the last couple of years, and I'm delighted to have you both here today.
Thanks for having us. Good to be back.
We keep hearing about these variants that are more transmissible, more transmissible, more transmissible. It's almost as each one has been, Delta to Omicron to now this one is entitled what again?
BA2.
BA2. What does that mean exactly?
If I'm standing next to you and you happen to be infected, and when you exhale, it's kind of airborne, it's in the droplets of your saliva, and I breathe it in, it takes less of that virus to make you ill. So it just hooks on, and once it gets into your system, it can duplicate a whole lot faster.
Okay, but with the vaccines, et cetera, the body's capacity to stop you from getting critically ill has been impacted in a good way.
Absolutely, we know that to be true. If you're vaccinated, you're almost 100% not going to be in the hospital or get a really severe illness.
Okay, all right. Dr. Kokinda, we've talked a lot about the mental things that have happened. What have you seen over the course of changing into this new, more open world? What kind of mental concerns should we be aware of?
It's very similar to what we were seeing before. It's just more change. A lot of us finally got comfortable, even with things we didn't like, just being aware of the dangers, wearing our mask, doing those things. And now suddenly people aren't wearing masks, you can go places, and as much as we've waited for that, it's a new change, and old habits die hard.
What are some of the things that you should be aware of that just add to the stress that we already have?
Watching the news, of course, and be informed, but limit it. Social media is another one. You want to be mindful of what you're taking in from your social media. A lot of people are gravitating to individuals who only think the way they do, which triggers a certain emotional response in us, and we're losing touch that people are people. We want to try to stay connected with everyone. And then the other thing is we really want to avoid drugs and alcohol. You can have maybe the glass happy hour, but we don't want to be using it for coping, because that takes us down a very unhealthy path.
Bad information propagates faster than right information. So what's the best source for the correct information? Can we trust the CDC? Can we trust,
Yes,
all of these?
You can.
Okay.
Yeah, you go to the CDC, your public health department. They've done, I think, a remarkable job of keeping data updated. One of my favorite sites is Johns Hopkins University. They have tracked this data internationally from day one. It's just great.
Okay. And you both are incredibly informative, and thank you for your consistency and your great information that you've been providing through this, albeit endless scenario of stressful times. So thank you both very, very much.
Thank you.
Thank you.